Hello, check, check.
Ladies and gentlemen, may I have your kind attention, please? I request all of you to kindly settle down with your mobile telephones and all electronic gadgets on silent mode, please. We shall be commencing this wonderful event in just about 5 minutes from now. So I request all of you to kindly settle down. And once our honorable dignitaries arrive in the hall, I shall request you to kindly welcome them with a huge round of applause. Thank you very much. And we look forward to a wonderful evening ahead. Ladies and gentlemen, may I have your kind attention, please? I request all of you to kindly be seated. We shall be commencing the event in just a couple of minutes from now. I need everybody to be seated so that the hall looks in order, so that the dignitaries can arrive on the stage. May I request everyone to kindly be seated, please, except for members of the press and media who have already taken their positions. Thank you. Vibrations of that. Ladies and gentlemen, may I request you to kindly be seated, please? Thank you. And another announcement for all mobile telephones and electronic gadgets to be on silent mode, please. Thank you very much. May we have the main exit doors closed, please? Thank you. The distinguished dignitaries will be arriving from my door on the extreme left-hand side. And once they arrive, I'll be calling their names. I will request you to kindly join me in giving them a warm round of applause as they come to the stage. Thank you. Ladies and gentlemen, do join me in giving a huge round of applause as we now welcome the distinguished dignitaries onto the stage. Dr. Tedros Adhanom Ghebreyesus, Director General of World Health Organization. His Excellency, Mr. Zahid Malik, Honorable Minister of Health and Family Welfare, Bangladesh. Her Excellency, Dasho Limpo Deshan Wangmo, Honorable Minister of Health, Bhutan. His Excellency, Dr. Mansukh El Mandaria, Honorable Union Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Ministry of Health and Family Welfare, Government of India. Her Excellency, Ms. Safia Mohammed Saeed, Honorable Minister of Health, Maldives. His Excellency, Mr. Mohan Bahadur Basnet, Honorable Minister of Health and Population, Nepal. His Excellency, Dr. Kehelia Rambuvela, Honorable Minister of Health, Sri Lanka. Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia. Dr. Hans-Henri P. Kluger, Regional Director, Euro. Let's give them a huge round of applause, ladies and gentlemen, as they now get seated on the stage. Distinguished dignitaries on the stage, our very respected delegates, respected members of the press and media, ladies and gentlemen. A very warm welcome goes to all of you attending the ministerial meeting, Sustain, Accelerate, and Innovate to End Tuberculosis in Southeast Asia region. I now have the privilege in inviting Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia, for her opening remarks, please.
Director General WHO, Dr. Tedros, Honorable Ministers of Health, Regional Director, Euro, Dr. Hans Kluge, distinguished partners, civil society representatives, welcome to this high-level meeting to end TB, which we embark on just 1 month before the second UN high-level meeting on TB, which is a tremendous opportunity. I express my sincere gratitude for your presence and my utmost thanks to community representatives who are not simply the heart, but the voice of our TB response. Today, we choose courage, hope, unity, and action. We renew a bold yet attainable vision. A Southeast Asia region where TB is no longer a public health problem, menacing millions of people with disease, death, poverty, and despair. And we take not 1 or 2, but several steps forward in a journey that began in 2017, when excellencies, our ministers of health from our region, made ending TB our regional 8th flagship priority, which was renewed in 2021 when high-level leaders unanimously adopted a new regional strategic plan towards ending TB. At the first UN high-level meeting on TB in 2018, Indian TB survivor Nandita Venkatesan made a simple yet urgent plea. For political leaders, policymakers, donors, and all other TB stakeholders globally to act now without delay. That urgency was embedded in the resulting UN political declaration on the fight against TB, which identified a series of global targets. That is, by 2022, to successfully treat at least 40 million people with TB, including 3.5 million children and 1.5 million people with drug-resistant TB. and at least 30 million people placed on TB preventive treatment. By 2021, the Southeast Asia region had achieved 67% of its apportioned target for treatment overall, 56% of its apportioned target for treatment of children, 50% of its apportioned target for treatment of drug-resistant TB, and 20% of its target for TB preventive treatment coverage. However, as a region, on 3 of the 4 UNHLM targets, we outperformed. Notably, we expect the latest data, which will be released next month, to highlight significant region-wide advances, with several high TB burden countries expected to have initiated more people on treatment in 2022 than in 2019. In other words, together we are bending the curve and must now accelerate momentum, shaping history to our will. For that, in the lead up to the second UNHLM, I have 4 requests to make. First, that at this meeting and beyond, we cultivate the highest level of political and operational commitment. Commitment not at one level or in one sector, but at all levels and in all sectors. Specifically, I urge leaders from each country to establish a high-level multi-sectoral commission on TB, which could also help build health systems resilience and advance universal health coverage and health security. Second, we must actively accelerate access to new TB tools, technological and treatment regimens that are people-centered and which are delivered at the primary healthcare level within the community. For this, I urge you to share experiences and lessons learned and agree on concrete measures to strengthen South-South collaboration with a focus on facilitating affordable national procurement. Third, let us allocate adequate and sustainable domestic resources to meet TB service coverage targets, building on the sustainable increases already achieved. In 2022, TB allocations in the region reached $1.4 billion, of which 60% was from domestic resources. However, for mission success, we need at least $3 billion annually, which we will also help maintain key social protection programs, such as for nutritional support. Fourth, we must continue to engage and empower TB-affected communities, not just listening to, but truly hearing them. On this, let us agree. In 2018, at the first UNHLM, action was needed without delay. Today, it is needed more urgent than ever. Together, let us seize the moment. Let us end TB. Thank you.
Thank you very much, ma'am, for your opening remarks. Ladies and gentlemen, it is now my privilege in requesting Dr. Tedros Adhanom Ghebreyesus, Director General of World Health Organization and co-chair of this event, for his inaugural keynote address, please.
Thank you, Madam Moderator. Sorry. Your Excellency, Dr. Mansukh Mandavia, Minister of Health and Family Welfare of India, Excellencies, Ministers, and my RDs, Dr. Poonam and Dr. Hans, Excellencies, dear colleagues and friends, Namaste. And good afternoon, and it's an honor to be here with you today. And I thank India for hosting this very important gathering. With almost half of the global TB burden, nowhere is the fight against TB more important than here in the Southeast Asia region. And here in India, a country with one of the highest burden of TB, I applaud the leadership of the Honorable Minister, the Honorable Prime Minister Narendra Modi, and the effort of the Minister with their commitment to end TB. India has ambitious targets backed by a substantial increase in domestic funding and implementation of innovative approaches and multi-sectoral action. This provides inspiration to other countries and leaders to prioritize ending TB. I would also like to acknowledge key partners represented here today, including the Global Fund, USAID, CDC, Bill and Melinda Gates Foundation, FIND, civil society organizations, and others. We need all hands on the deck to end TB. This is a disease that afflicted humanity for millennia and remains one of the world's top infectious killers. TB kills 1.6 million people each year and affects millions more, with enormous impacts on families and communities. Over the past 2 decades, we have made significant progress in the fight against TB. Since 2000, 74 million more people are able to access TB services. However, major disruptions from the COVID-19 pandemic and other global crises have reversed progress in many countries, including in the Southeast Asia region, causing a drop in the number of people able to access diagnosis and treatment. In the Sustainable Development Goals, countries committed to the target of ending the global TB epidemic by 2030. It's an extremely ambitious but achievable target. We have new and powerful tools to do it, including rapid tests, which reduce testing times from 3 days to less than 2 hours, and new oral treatment regimes for drug-resistant TB that reduce treatment times from 18 months to 6 months. These are game changers for diagnosis and treatment, and both are now becoming widely available in more than 100 countries. But there is one important tool we still need, and that's a new vaccine. The only licensed TB vaccine, BCG, was developed more than a century ago. It saved thousands of lives every year by protecting young children, but does not adequately protect adolescents and adults, who account for most TB transmission. That's why earlier this year, WHO also established a TB Vaccine Acceleration Council to facilitate the development, licensing, and equitable use of new TB vaccines. The Council will work to boost the TB vaccine pipeline and facilitate the licensing and use of safe and effective TB vaccines through partnership-based innovative solutions to close critical gaps in knowledge and financing. The COVID-19 pandemic demonstrated what's possible, that with political and financial commitment, new and powerful vaccines can be developed quickly and distributed widely. TB is a different scientific challenge to COVID, but where there is a will, there is a way. As is the case for so many health challenges that afflict the world's poorest and most vulnerable, the key challenge we face is one of political commitment. That's why the second high-level meeting on TB at the UN General Assembly next month is so important. WHO is calling on world leaders to commit to concrete targets for the next 5 years. First, to reach 90% of people with TB prevention and care. Second, to use the WHO recommended rapid test as the first method of diagnosis. Third, to provide social benefit packages to all people with TB so they don't endure financial hardship. And fourth, to license at least one new TB vaccine. To accomplish these goals, we need to close the funding gaps for TB care and invest in research and innovation. At the same time, we need to address the drivers of TB: poverty, malnutrition, diabetes, HIV, tobacco and alcohol use, poor living and working conditions, stigma and discrimination, and more. I created the Civil Society Task Force on TB to advise us on addressing these issues. I'm pleased to see some members of the task force present here. Today's ministerial meeting is vital for ensuring highest level participation from countries to work closely with civil society, communities, and other stakeholders to contribute to re-energize commitments to end TB. My thanks once again to the government of India and to all countries of the Southeast Asia region for your continuing commitment to the fight against TB. And finally, I would also like to thank and express my respect and appreciation to my sister, R.D. Poonam Singh Khetrapal. Together, we can turn the tide against this ancient killer. Bahut Bahut Dhanyavad. I thank you.
Thank you very much, sir, for your wonderful inaugural keynote address. Ladies and gentlemen, it is now my privilege and indeed an honor in requesting His Excellency Dr. Mansukh L. Mandavia, Honorable Union Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Government of India, co-chair of this event for the inaugural keynote address, please.
Thank you. Present on dais, Mr. Jahid Malik, Excellency Health Minister of Bangladesh, Leon Podasho Dechen Wangmu, Excellency Health Minister Bhutan, Kehlia Rambuk Vela, Excellency Health Minister Sri Lanka, Mohan Bahadur Basnet, Health Minister Nepal, Tapia Muhammad Said, Deputy Health Minister Maldives, Dr. Tedros, Director General World Health Organization, Hans Hendrik Koch, WHO Regional Director Europe, Poonam Khetrapal Singh, WHO Southeast Asian Region. Namaste. Sustain, accelerate, and innovate to end TB in the Southeast Asia region. I thank all of you for joining us today to discuss the important agenda on combating tuberculosis. This year, we observe World TB Day at the One World TB Summit in India at Varanasi, Uttar Pradesh, essentially highlighting the ethos of One World, One Health that our Honorable Prime Minister strongly believe in. Excellencies, India has been at the forefront of the response to the global public health challenges posed by tuberculosis. Under the dynamic leadership of our Honorable Prime Minister, we have committed to eliminating tuberculosis from India by 2025, which is 5 years ahead of the target to the global SDG goal. Following this commitment, India strengthened the approach towards TB elimination and made tremendous efforts. In this regard, I am proud to highlight that India leveraged the power of data-driven decision by developing its own mathematical model to estimate tuberculosis burden using local evidence. Through its dedicated efforts, India has achieved a 13% reduction in TB incident and 15% decrease in mortality from 2015 to 2022, performing better than global average. Excellencies, to identify all missing cases by reaching the unreached and ensuring universal health coverage under the leadership of our Honorable Prime Ministers. India established our 1.6 lakh health and wellness center. Yesterday, Dr. Tedros visited to Health and Wellness Center to provide tuberculosis detection and treatment services to all patients, along with a host of other primary healthcare services. Through enhanced private sector engagement and sustainable models, the notification of tuberculosis has improved by as high as 7 times in the past decade. Excellencies, it is unfortunate that the stigma against tuberculosis is still prevalent in our societies. Therefore, India has been committed to providing enabling and patient-centric support to all individuals suffering from tuberculosis. During the One World TB Summit, the Honorable Prime Minister launched a family-centric care model, which takes into the consideration the social aspects of the disease and the positive role that families play in TB recovery. India also implemented a first of its kind community engagement mechanism to combat stigma and mobilize people from all walks of life to support those on TB treatment. Honorable President of India launched the Pradhan Mantri TB Mukt Bharat Abhiyan in September 2022 to provide a supportive environment to all patients in the country. We call upon individuals, elected leaders, political parties, corporate ministries to work with the TB patients in the treatment journey by becoming Nikshay Mitra and provide additional nutritional, diagnostic, and vocational support to them. Excellencies, through Jan Bhagidari, means people's engagement approach under Pradhan Mantri TB Mukt Bharat Abhiyan, we are raising an estimated $146 million in a year to address the problem of undernutrition. India established a social support scheme, Nikshay Poshan Yojana, This initiative provides monthly nutritional support to those on TB treatment through direct benefit transfer. I'm happy to highlight that since 2018, over $244 million has been transferred to the bank account of 7.5 million TB patients. The ration trial, which got recently published, validates the importance of nutrition in reducing TB mortality as well as incidence. Although vaccine development is underway, we must fast track our efforts, drawing lessons from the COVID-19 pandemic. Excellency, collaborative efforts and equitable access to diagnostic, prevention, and treatment options are pivotal to ending TB as demonstrated by the pandemic. India is committed to sharing its learning with the world and learning from other contexts as well. I strongly believe that with our continued effort and determination, we can eliminate TB from the world before 2030. This is an important year for the world, as we will gather again at the UN high-level meeting on TB in September. It will be a chance for us to reckon with the collective progress made towards the ambitious target set to end tuberculosis. Collective and collaborative efforts within Southeast Asian region countries would be a key to ending tuberculosis. Thank you. Thank you very much.
Thank you very much, Your Excellency, for your most wonderful inaugural keynote address. Thank you, sir. I now have the privilege in inviting Shri Sudhansh Pant, Secretary, Health, Ministry of Health and Family Welfare, to kindly share the best practices from India, please.
Representation इस से क्लिक करना
Namaskar. Our Honorable Minister for Health and Family Welfare, Chemical and Fertilizers, Government of India, Dr. Mansukh Bhai Mandviya ji, Honorable DG WHO, Dr. Tedros, Excellency Health Minister of Bangladesh, Shri Zahid Malik, Her Excellency Health Minister of Bhutan, Madam Wangmo, Excellency Health Minister Nepal, Shri Mohan Bahadur Basnet, Excellency Deputy Health Minister Maldives, Madam Safia Mohammad Saeed, WHO Southeast Asia Regional Director, Dr. Poonam Ketpal Singh, WHO Regional Director Europe, Dr. Hans Klug, all distinguished officials, participants, stakeholders, ladies and gentlemen. Our Honorable Minister has already highlighted quite a few of the initiatives and best practices which India as a country has adopted in tackling tuberculosis. I would be formalizing it in the form of a presentation so that the effective steps which have been taken over the last few years could reach out to a larger audience.
की घोषणा कर रहा हूं कि भारत में वर्ष 2030 के 5 साल और पहले यानी 2025 तक टीबी को खत्म करने का लक्ष्य हमने तय किया।
So, ladies and gentlemen, this was the announcement made by Honorable Prime Minister in 2018, where he declared that 5 years before the SDG target of eliminating TB by 2030, India would be doing it by end of 2025. And as we all know, what it entails, if we say we have to end TB, 80% reduction in incidence, 90% mortality, and 0% out-of-pocket expenditure. And then very recently, on the World TB Day in March of this year, he again reiterated the India's commitment towards elimination by 2025. So, as a nation, we are committed to fulfilling the declaration made by Honorable Prime Minister. And this chart just shows how the resources have been mobilized for TB. And annual TB funding has more than doubled. It was around 260 million in 2015, and it's reached a level of 671 million already. So it's more than 2 times in 7-8 years. And more than 80% of the funding is from government domestic resources. That is also very encouraging. As regional director in her inaugural mentioned, that they expect around 60%. We've already reached about 80% of domestic resources. Then leveraging additional resources from our health system. So this is just the budget of the TB program, but we have dovetailed it with several other of our health programs like health and wellness centers, where last year there was more than 14 million screenings done. Other aspects of our health, various health programs, they are contributing towards doing a lot of screening and testing work for the TB. We've also introduced performance-based innovative financing from various partners. These incentives are for the private sector as well as for our own health personnel who are doing a great job in early detection and then leading towards the treatment of TB. And then there's a continuous process of a health technology assessment, whereby every new technology which comes in is put through a committee. They do the normal testing, and then if it is found reasonable, then it is put to use in the Indian system. This very important portal end to end, it tracks every TB patient right from the point the disease is detected till the outcome. So it is totally online, it's real-time based. It has disease management and prevention. It has a dashboard, it is accessible, easily accessible. It has played a very important and vital role in the fight against TB in the Indian context. And this totally in-house developed portal, we call it NIC Share. Then under the National TB Elimination Program, as you can see over the years, the participation of the private sector has increased tremendously. On the first bar on the left, in 2015, we had hardly 180,000 notifications in the private sector. In 2022, we have 7.36, nearly 4 times more notifications in the private sector in the last 7-8 years. And this was one area in which we were not doing so well earlier. But with a lot of emphasis, the last few years, the notification in the private sector has gone up. Even the total case detection has almost reached a level of 2.5 million in 2022. Because of COVID, we had a dip in 2020 from 2.4 million to about 1.8 million. Had that not happened, perhaps we would have reached our estimated case level of maybe 2.6 to 2.7 million. So the gap has also narrowed down to about 200,000, which was till some years back, it was about 1 million gap between the estimates and the notified TB cases. So that has been some tremendous progress made as far as reducing this gap is concerned. And this, as I was mentioning, the involvement of the private sector from 2017, 383,000 to 733,000. 2015 it was about 180,000. So there's been a lot of involvement of the private sector. And this has happened because of certain steps we have taken. The enforcement of mandatory notification of TB cases, we have made it a penal offense if mandatory notification does not take place. So that acts as a deterrent against hiding of such cases, notifications. This has had an impact in spurring the private sector also. Then interface agencies have been put into action for linking the private and public sectors and closing the gap. And as I said, we're also providing incentives to the private sector, even to our health personnel who help in detection or reporting of cases. This is how all these have altogether contributed towards our better management. Then community-led development has been one of the key features over the last few years, which has resulted tremendously in dealing with TB. So community volunteers, we have a treatment supporter, community volunteers support people with TB and motivate them to complete the treatment, not give it up midway. And then we have TB champions. They are the survivors. We call them TB Vijeta. They are the survivors who have been through the disease, and then they help in advocacy. They help in reducing the stigma and in other linkages of various kinds of services. And then we have the Nikshay Mitra. Mitra means friend in English. So Nikshay Mitra can be an individual, it can be an organization. And these Nikshay Mitra are motivated to adopt consenting TB patients. And they are assisted in many ways. And here I would like to mention that a lot of prominent people have volunteered to become Nikshay Mitras, including our Honorable Minister, Dr. Mansukh Bhai Mandviya. He has also volunteered as a Nikshay Mitra. He has adopted all the TB patients in his block, in his native Palitana district, in Palitana block in Bhavnagar district of Gujarat. Likewise, a lot of other senior officials, ministers, politicians, they have led right from the front. They have led by example. And that is the result that we have more than 96,000 Nikshay Mitras. They're all volunteers. They are taking care of the TB patients. They have adopted the TB patients in a way. And then we have the concept of a family caregiver. One person in the family of the affected TB patient, and that person takes on the work of counseling, treatment compliance, moral support, psychological support, and all the things which come with the TB patient. In this Pradhan Mantri TB Mukt Bharat Abhiyan, briefly alluded to by Honorable Minister. And this is the Nikshay 2.0 portal. Through this portal and through this Abhiyan is a campaign. It aims to link all TB patients on treatment with a Nikshay Mitra, with a friend, for providing community support. And this is a real-time picture of the dashboard, which shows that nearly 1.4 million patients are on TB treatment, out of which about 1.09 million have consented to receive community support. And of those who have consented, nearly 100%, 1.09 million, have some Nikshay Mitra to support them, to adopt them. So this shows the kind of success which the Nikshay Mitra concept has brought in. Nearly all the TB patients who have consented to be taken care of by a volunteer, they have found a volunteer, and these volunteer Nikshay Mitras are doing a fantastic job in looking after their TB patients. And this is 96,000, as was shown earlier also. They are the number of Nikshay Mitras already registered. One of the things which the Nikshay Mitras provide is also a nutritional food basket. This is a kind of a balanced diet. It's been developed by our National Institute of Nutrition in Hyderabad. It has cereals, millets, pulses, oil, groundnuts, milk, fruits, vegetables, vitamin, minerals, everything. And if for the non-vegetarian person, there's also an option of eggs. So this kind of baskets are provided by the Nikshay Mitras to the TB patients, because it has been established in many studies that there's a direct correlation between TB patients getting cured and the kind of nutritional or dietary support they have. And in the community support for TB patients, who can be Nikshay Mitra? As I said, it could be a society, corporates, elected representative institutions, NGOs, political parties, individuals. The support could be for 6 months to 1 year, 2 years, 3 years. It's up to the Nikshay Mitra whom we motivate. And there can be a nutritional support. They could provide diagnostic support, vocational, or even additional nutritional supplements. The support can be to a state, it can be to a district, it can be to a block, or it can be through a health institution. So when we talk of the TB burden in India, from the graphs, without going into the details, I would just invite your attention to the red line. It is the first graph on the left. It shows the incidence, TB incidence estimation. There has been a downward trend in the country over the last few years. And the graph on the right, if you focus on the red line, it is the proposed India TB report for the current year. It also shows a dramatic reduction in the TB mortality estimation for 22-23. So on both incidence as well as in mortality, there has been substantial reduction in the last few years because of the various efforts which have been made in this regard. On the diagnostic side, in 22 itself, in 1 year, 18 million people have been tested for TB. And 221 million people have been screened in active case finding, which itself is a huge number. And out of these 18 million, about 938,000 people with TB got drug resistance testing done. The graph on the right, it shows the way in which the NAT laboratories and the NAT testing has expanded in the country. Last year, it touched a level of more than 5.8 million tests. And even the number of machines have now exceeded 5,000, which till some years back, it was like 600 odd. And at present, this is just to give you an idea of the kind of infrastructure which is there for dealing with TB, about more than 23,000 microscopies, 5,000 plus NAT machines, about 80 culture and drug sensitivity testing laboratories, about 108 mobile units, they're already there. And every year, we are adding new numbers because the government is totally committed to its aim of elimination of TB. Now, this graph also shows that how over the years, the success rate for both drug-sensitive TB on the top line, which is touched 85% from 69% some years back. Likewise, for multi-drug resistant TB, the success rate has touched 68%, up from 49% 5 years back. And even in the extreme drug resistant TB, there has been almost almost a double increase from 34 to 62% between 2017 and 2020. So in all kinds of TB, whether it's sensitive or resistant, there has been tremendous success rate in the treatment of TB. And this has been one of the success stories also for the country. So briefly, the way forward is expansion of prevention interventions, because now we believe that we need to focus a lot on prevention rather than just the the cure or the treatment. Galvanizing community support has proved to be very useful. We propose to strengthen it further and introduce some new concepts by involving our elected local bodies, both in the urban and the rural areas. Then the decentralized TB services through the health and wellness centers. We have 160,000 of these centers already, and we propose to use this great asset which we have in the medical sector to also get more involved in TB services. Use of technology, including artificial intelligence, start has already been made on this count, and now we are going to develop it further. It'll help us in our campaign against the TB. Adopt newer evidence-based drugs and diagnostics. We're already trying and introduce some new kinds of drugs, diagnostic tools. This we also hope will further strengthen our country's fight. And lastly, to drive innovation in program operations. This is a constant thing. We try and do some innovative things, some operations, also try and exchange ideas with everyone. So this, ladies and gentlemen, in a nutshell, was the highlights of our best practices, which we are trying in India. We stand fully committed to the declaration made by Honorable Prime Minister to end TB by 2025. Thank you, Jai Hind.
Thank you very much, sir, for your conclusion on sharing best practices from India. Thank you very much for a wonderful presentation. I now invite, and I have the privilege in inviting, Dr. Hans-Henry Kluge, the WHO Regional Director for Europe, to kindly share experiences from the European region, please. May I request you, sir, for your address.
Esteemed co-chairs, WHO Director General Dr. Tedros, my elder brother, Excellency Minister Mansukh Mandavia, my elder sister, Regional Director SEAR Dr. Poonam Singh, Excellencies, Minister of Health of the Southeast Asia region, Professor Mario Ravigloni, my teacher in tuberculosis, Blessina, and everyone from civil society, dear TB family. What a pleasure for me, as I was telling this morning, at the Global Summit on Traditional Medicine, to be back, even briefly, in the Southeast Asia region, where I spent 5 years of my WHO tenure in Myanmar, and where I professionally and personally grew a lot. I really want to thank the Southeast Asia region for being such a school for me. If we speak about TB in the WHO European region, which encompasses 53 member states, going from Greenland to Vladivostok, until 3.5 years ago, we were a very good pupil in the class. Actually, we reached the end TB strategy target of 20% decrease of incidence by 2020 and surpassed it by 25%. But this was until COVID-19 hit our region. And that you see at the right of the slide, where there was really a tremendous drop in case notification of 24% drop. Globally was a drop of 18%, but we went to 24% in 2020 and then partially recovered. But this also had the result that the TB mortality increased, and it actually became the second cause of death in our region. At the same time, we are holding the highest burden of drug-resistant tuberculosis globally, particularly in the eastern part of the region. We are home to 24% of the global burden of MDR TB and 47% of the global burden of pre-XDR TB, with, until recently, I have to stress, until recently, a low treatment success rate of about 56%, which is below the target of 75%. Having said that, we try to be optimists and always look that the glass is half full and not half empty. And we are very committed to the uptake and dissemination of innovations, like the host country, India and the other countries in the region. I myself used to be for 25 years a TB doctor, and I remember that when treating MDR TB patients, it took 24 months with almost 15,000 pills, with 8 months of painful injections. I can tell you, to put every day the injection into the butt of a child, which is painful, is very, very traumatic. As our WHO Director General, Dr. Tedros, was mentioning, this is a revolution that we now have a treatment regimen of 6 months, as long as drug-sensitive TB treatment, without any injections. And we have a cohort of about now 6,000 patients that we're evaluating, and preliminary 85% successful outcome. So we really have to take advantage of this new treatment regimens. At the bottom of the slide at the left, you see application, for example, in Tajikistan, of artificial intelligence for TB screening. In the middle, you see the rapid molecular diagnostic tests, which drastically reduce delay in starting TB treatment. And at the right, you see our guidelines on what we call VST, which is video supported treatment, which became a global standard. Now, going forward, we had a meeting, as you see at the left, with always WHO headquarters, with our director, Teresa Kasaiva, and with the colleagues from Uzbekistan and Poland, who are the co-chairs, the co-facilitators of the UN high-level meeting, on the new tuberculosis action plan that we finished 2023-2030. And let me mention 3 points there. The first one is to tackle affordability of TB diagnosis and treatment, because even in the richest countries, it are the poor people who are affected. So we put a lot of attention, like you are doing, on equity and human rights approach. The second one is that we still need to go faster on scaling up digital tools and other innovations. And third one was mentioned by Excellency Secretary General of the Minister, Secretary of Minister of Health India, is on the prevention, both preventive treatment and vaccination. Together with my sister, Dr. Poonam Singh, we were at the World Health Assembly session at the Polish Embassy on the UN high-level meeting. And that's why I came here to reach out to further inter-regional collaboration. If we have inter-regional collaboration, we always do it under the guide of WHO headquarters. You see on the picture here, the director under the guidance of Dr. Tedros. And we believe that we have a lot to learn from the region. And again, congratulations, particularly to the host country, India, Prime Minister, you Minister, for this bold commitment to eliminate TB in the coming years. I was mentioning my time in Southeast Asia when I spent 5 years in Myanmar, and I was tackling with the colleagues tuberculosis, but also the humanitarian crisis of Cyclone Nargis when I was there. And I give this picture because DG, my brother Dr. Tedros mentioned already, it's not a medical disease. It's a societal disease and disease of people who are often at the margins. And here you see the first mobile health team. It was about the TB. The TB family is often the most proactive. We put out few days after the cyclone hit to trace the TB patients. The wonderful ladies in the red robes you see, they lost their children. Actually, the bench of the river was full of houses, but washed away by the cyclone. And they told Dr. Hans, you are not going to go alone. We're going to go with you. The resilience of the healthcare workers in Myanmar and Southeast Asia is a very big lesson for us in the West. And you see me at the left over there. I have to say very big thank you and admiration to Dr. Poonam Singh, who was my Deputy Region Director, who came to help out at that time immediately. And we were tracing to leave no one behind. I remember that the National TB Program Manager, Dr. Owen Mong, was with me. We called him SEAR. SEAR in Myanmar means master. And we had to sleep in that boat. And I remember at nighttime, those very anxious times, I was hearing noise in the water. You know, there are a lot of very dangerous crocodiles who could eat that boat in one hap. I say, Seya, I think Mama Crocodile is approaching. Because as a young doctor, I was very afraid. He told Nili. Nili meant Burmese for younger brother. He called me Nili. Nili, he told, don't be afraid. For sure, the cyclone also washed away all Mama Crocodile. And after that, I could sleep quiet. Why I tell this story is that when you're very stressed and you have tough times, friendship and a bit of humor is very, very important. So, in that context, I want to thank all of you, DG, Dr. Poonam, Minister of Health of India, for inviting us here. I'm reaching out for inter-region collaboration under the motto of India's G20 presidency. Vasudhaiva Kutumbakam. One Earth, one family, one future. Dhanyavad.
Thank you so much indeed for a most wonderful address, sir. Thank you. Well, now I'll be calling on the honorable ministers in alphabetical order, and we will start with giving a warm round of applause as I invite His Excellency, Mr. Zahid Malik, Honorable Minister of Health and Family Welfare, Bangladesh, to kindly give his ministerial address in support of the joint declaration, please.
Excellencies, DG WHO Dr. Tedros, Minister of Health of India, Mansukh Mandaria, Regional Director WHO, Ministers, heads of delegations, distinguished guests, ladies and gentlemen, colleagues and friends. Thank you for inviting me to speak before you. Thank you for the opportunity. A very good afternoon. Assalamu alaikum and namaste. I really appreciate Ministry of Health, India and WHO for organizing this timely initiative, which has created an opportunity to review Southeast Asia regional progress on TV in relation with 2015 NTV targets. I also take this opportunity to extend my gratitude to the Honorable Prime Minister of India, Sri Narendra Modi ji, for his great contribution and guidance to control and treat TB in India and beyond. I also thank the Honorable Minister of Health Minister of India for his support to us and to this meeting. It has been an eye-opener for us to learn the Indian efforts to control and treat TB. I am really amazed to know the steps taken to control TB. That is, the budget has been doubled in India. NICSHE, this NICSHE system is working very well, and also the private sector involvement, community volunteers, Also, the health minister has said that he also adopted some few TB patients in supporting them. So these are wonderful experiences, knowledge, which will help all of us in controlling TB in our respective countries. Ladies and gentlemen, tuberculosis is a major public problem in Bangladesh, among the 30 high TB burdened countries in the world, with a population of over 169 million. 8 countries accounted for 2/3 of the new TB cases, and Bangladesh is one of them. Bangladesh, like other low and middle income countries, is facing a double burden of disease. While infectious disease remain a significant public health threat, non-communicable and lifestyle diseases are increasingly threatening the health of the population. The country has a significant prevalence of smoking, diabetes, and undernutrition, all of which contribute to driving the TB epidemic. Distinguished ladies and gentlemen, in 2021, the WHO estimate that there were 375,000 people who developed TB in Bangladesh, and 42,000 people died of the disease. The country notified a total of 300,000 TB patients in 2021, which represents a treatment coverage of 82%. It also implies that about 68,000 people 60,000 people developed TB in Bangladesh in 2021 are not accounted for. These are the missing people with TB. Ladies and gentlemen, Bangladesh has performed excellently in terms of finding people with TB and I am demonstrating few commendable successes. Treatment success rate now in Bangladesh is about 95%. TB mortality in 2006 was 54 per 100,000, which is in total, which is about 77,000 people. Now it has decreased to 25 per 100,000, which is a reduction of 43,000 in mortality at the moment. Bangladesh introduced gene expert machines and advanced molecular diagnostic technology for testing TB in 2012. And in all the Upazila, that is sub-district of Bangladesh, which is over 500, is having this machine. The total machine we are having 588. These are advanced machine for TB detection. Government has declared TB as a notifiable disease. To notify TB cases diagnosed is mandatory, and which has been made mandatory. 100% electronic recording and reporting tool has been introduced in Bangladesh. The government of Bangladesh procuring first-line TB drugs since 2018 from GOB funding and established local manufacturing of TB drugs by local pharmaceutical companies since 2022. So we produce our own TB drugs in Bangladesh. Bangladesh launched the National Costed TB SEAR Action Plan. It provides a comprehensive framework for identifying and overcoming communities' rights and gender barriers in the TB program. During COVID, there has been a setback. There was a drop in the notification rate of TB for obvious reasons. despite the significant interruption to delivery services in the first half of 2020, the country achieved a quick return to pre-pandemic notification levels by 2021. The main contributing factors Bangladesh's success recovery was immediate adaptive actions were taken by government, enhanced collaboration and partnership with NGOs, community engagement for both COVID and TB, screening, referrals, and testing. TB diagnostic, particularly the gene expert machines, were utilized for COVID test and bidirectional TB COVID was established in around 70 sites. Distinguished guests, though Bangladesh achieved remarkable progress in TB control, but still we have got challenges to overcome. As per 2021 notification, data includes that 19% of all TB cases are still missing. Urban TB and hard-to-reach areas, including prison intervention, yet needed to be strengthened. Child TB and extrapulmonary TB diagnosis in district to upazila level is quite challenging, which we are trying to overcome. There is also a funding gap, which is critical during the COVID period. Bangladesh tries to overcome this situation through clear policies, strategies, plans, and guidelines for an effective TB response in play India. And we have the political commitment also from our Prime Minister office to take up new strategies to remove the stigma in the society and extend necessary treatment to all patients, especially given more attention to the diagnosis and to the missing cases. Intensified efforts and increased funding remain urgently needed to combat the negative impacts of the COVID pandemic of TB in 2000 and beyond. Investment needs to be prioritized for health system, strengthening surveillance capacity. Transition and sustainability plan for integrated TB program by government of Bangladesh. Gradual transition is required from donor funding is still need to prioritize for TB in Bangladesh. I take this opportunity to say that regional cooperation with neighboring countries can foster knowledge sharing, harmonize strategies, and pool resources for a more effective region-wide TB response. And I want to thank our development partners, donors, particularly the WHO, Global Fund, USAID, and many others for supporting to undertake a robust TB control program in Bangladesh. Dear friends, Bangladesh will continue its commitment and engagement with global community and will undertake all necessary measures in updating country strategy in line with global strategy and policy directions in upcoming years. I and my team extend our gratitude to WHO and Government of India for their excellent arrangement and hospitality. Thank you. Assalamu alaikum. Namaste.
Thank you very much indeed, Your Excellency, from Bangladesh, for your most wonderful address on the support of the joint declaration. Ladies and gentlemen, do join me in giving a very warm round of applause as we have on stage with us His Excellency Dr. Kehelia Rambuvela, Honorable Minister of Health, Sri Lanka, Let's give him a round of applause. I now have the privilege in inviting Her Excellency Dasho Lampo Deshan Wangmo, Honorable Minister of Health, Bhutan, to kindly give her ministerial address in support of the joint declaration, please.
Mrs. Angbo, a very good evening to all of you who are gathered here. My fellow ministers, Director General Dr. Tedros, World Health Organization, regional directors of the Southeast Asia region and the European region, delegates, experts, civil societies, and donor partners to NTV. A very warm greetings from the people and the government of Bhutan. We are gathered here today to address a pressing issue that demands our urgent attention, ending tuberculosis in our region. As we gathered here in this ministerial meeting, it is crucial that we acknowledge the profound impact of this devastating disease. This devastating disease has on our societies, our economies, and most importantly, on the lives of the people. Our region is home to 43% of the TB burden. TB continues to be a significant global public health challenge, causing immense suffering and preventing countless individuals from reaching its full potential. In Bhutan and the Southeast Asia region, despite commendable effort, we continue to grapple with the TB burden. And we cannot overlook the multifaceted consequences that TB imposes on our society, from causing immense strain on our healthcare system to perpetuating poverty and inequalities across the nation, region, and the world. However, we must now allow these challenges to deter us from our commitment to end TB. And the time is now to act boldly, collectively, and decisively. We welcome and commit to the implementation of the provision of the Gandhinagar Declaration. Aligned to the declaration, we would like to propose a comprehensive 5-point implementation strategies to realize the aspiration of the Gandhinagar Declaration so that the declaration does not remain on the paper. First, we must strengthen the healthcare system with a particular emphasis on early diagnosis, treatment, and long-term care of TB patients. This will require increased investment in health infrastructure, trained healthcare workers, and availability of quality diagnostic and life-saving medicine. We would like to call on our development partners to work on our strategies to make diagnostic accessible and affordable to all. I would like to take a moment to acknowledge the Global Fund for supporting the TB program in Bhutan since the introduction of TB. And with their support, today I'm happy to inform that Bhutan has adopted Gene Expert as a first line of diagnostic in Bhutan across the country. And thank you, Global Fund, for your support. Second, we must prioritize community engagement and empowerment by involving communities at all levels, from creating awareness to providing support during treatment. We are more likely to achieve effective outcomes and reduce stigmatization around TB. This approach will foster a sense of ownership and collaboration essential for lasting impact and change. I would like to congratulate the government of India for this innovative ideas of using the community system to empower communities and reach treatment and improve accessibility to treatment and care services. And I hope that these programs can be replicated and scaled up to other parts of our region as well. So this I see as a great opportunity to learn from each other so that we can achieve the regional aspiration to end TB. Third, we need to intensify the effort in reaching out the vulnerable population, such as those living in remote areas, migrants, and prisoners. These communities often face limited access to health services, coupled with the precarious living conditions, making them particularly vulnerable to TB. We must ensure equitable access of prevention, testing, and treatment for all, and leaving no one behind. Furthermore, we must promote innovation and research, as Dr. Tedros highlighted earlier in his speech, encouraging advancement in technology, such as point-of-care diagnostic and digital health solution, as presented earlier by the Secretary of Ministry of Health, Government of India, which will enable us to detect and treat TB more efficiently and holistically. Last, on my fifth point, we must forge a stronger regional partnership, working closely with our neighboring countries. As we all know, TB is a public notifiable disease, and we all as a region has the responsibility to build an excellent, robust surveillance system if we are serious about ending TB. International organizations, civil societies, and private sectors also has a huge role to play in this journey towards ending tuberculosis. By sharing best practices, resources, and knowledge, we can amplify our impact and accelerate progress in TB control and prevention. Honorable ministers, ending TB demands our collective determination, unwavering commitment, and decisive action. Let us join forces today to build a future where there is no individual suffering from the curable disease, and where every child, every woman, and every man can thrive and unburdened by tuberculosis. Together, we can make these lasting differences, not only in the lives of our citizens, but also in the trajectory of our nation. Let us leave this ministerial meeting with a united resolute to implement the Gandhinagar Declaration. I thank you for your attention. Tashidale.
Thank you very much, Your Excellency, for a most wonderful address, Honorable Minister of Health from Bhutan, for your ministerial address in support of the joint declaration. Ladies and gentlemen, we now have a recorded video message for you by His Excellency Budi Gunadi Sadikin, Honorable Minister of Health from Indonesia. The video will now be played.
Excellencies, distinguished guests, and members of the WHO Southeast Asia region, ladies and gentlemen, tuberculosis continues to be a global health threat, affecting millions of lives and causing immense suffering in our region and beyond. We recognize that tuberculosis is not merely a health issue. It is a concern that impacts societies, economies, and the overall well-being of our people. As a nation, we are determined to confront this challenge head-on by implementing evidence-based strategies, innovative financing, and a whole-of-society approach. Recalling the political declaration that was made at the United Nations high-level meeting in 2018, reaffirming our commitment to ending tuberculosis, Indonesia reiterates its unwavering commitment to ending tuberculosis within our borders, contributing to the regional and global efforts. Over the years, Indonesia has made significant strides in tuberculosis control, and we are proud of the progress achieved. In 2022, we reached 75% of tuberculosis case detection rate, marking the greatest achievement in our country history so far. However, we acknowledge that there is much more to be done. Our commitment towards ending tuberculosis is rooted in a strong determination to leave no one behind, to provide quality care to every person affected by tuberculosis, and to build a resilient health system capable of responding effectively to future health crises. As part of our commitment, I'm delighted to support the WHO flagship initiative to find and cure 90% of people living with tuberculosis by 2027. Indonesia participation in tuberculosis vaccine clinical trial will hopefully strengthen South and South collaboration. We are committed to sharing our experiences, best practices, and lessons learned with our fellow countries in the Southeast Asia region. We are ready to collaborate on research, innovation, and knowledge exchange to strengthen our collective response to tuberculosis and other health challenges. Furthermore, Indonesia supports the United Nations High-Level Meeting on Tuberculosis in 2023. This meeting will present a unique opportunity to mobilize political commitment, strengthen global partnerships, and secure the resources needed to accelerate progress towards ending tuberculosis by 2030. Today, I call upon all member states in the Southeast Asia region to join hands with us in this united front against tuberculosis. Together, we can build a healthier, more prosperous future for our people, free from the burden of tuberculosis. Let us seize this moment to reaffirm our commitment, strengthen our partnerships, and work towards ending tuberculosis and achieving universal health coverage for all. Thank you.
That was a wonderful video message, which is given to us. And now we move to the next ministerial address. And for that, I have the proud privilege and honor in requesting Her Excellency, Ms. Safia Mohammed Saeed, Honorable Deputy Minister of Health from Maldives, to kindly give her ministerial address on the joint declaration, please.
Director General Dr. Tedros, Honorable Minister of Family and Welfare Dr. Mansuk, Honorable Ministers, Regional Director for Southeast Asia Dr. Poonam, Regional Director for the Euro Dr. Hans, TB experts, members of the civil society, distinguished guests, ladies and gentlemen, Assalamu alaikum, and a very good evening to you all. It is a great honor and a privilege to be representing Maldives in this very august occasion in this month of August, pardon the pun, where we reaffirm our commitment to end tuberculosis endemic by 2030 through the Gandhinagar Declaration. It has been iterated over multiple presentations and forums that Southeast Asia region bears approximately 45% of the world's TB burden and still remains one of the most vulnerable regions to this endemic. The wide range of geographical characteristics, cultures, food, education, access to healthcare, all contribute to our disease burdens. In fact, one can argue that Dr. Poonam probably has one of the most diverse and interesting profiles of countries to look after. Though this may be the case for TB, let us also not forget that Southeast Asia achieved unprecedented number of public health achievements. I'm trying my hand at boasting, but trying to be humble as well. Now, speaking about Maldives, my country is truly a fascinating case study in terms of geography, population distribution, and the way our health system is designed to deliver essential health services to all. On one hand, we have sandy beaches, crystal clear lagoons, and blue seas that make for idyllic isolation points and uncongested spaces. Truly a paradise to enjoy the sunny side of life and a safe space if there is a disease breakout. On the other hand, we have the Greater Mala region, which in typical fashion of an urban domain is packed full with over 250,000 people as projected by our last census. A single group of infectious people or one infectious person, in fact, can result in an unbearable strain due to multiple clusters, an unbearable strain on our country's resources and medical facilities. It can be quite dangerous. Nonetheless, Maldives has attained a record number of public health achievements, eliminations, and reduced transmissions of communicable and neglected tropical diseases. And we are proud believers and implementers of the ethos that primary healthcare is the foundation and the primary driver for achieving universal health coverage. Our history with TB is a testament to this ethos. Maldives identified TB as a problem in the early 1960s and soon after established the first clinic to address the issue. We followed this by inviting the first WHO team to assess the TB situation in Maldives. Our TB prevalence was 35 out of a 1,000 population, and the first official TB program was born. This was in the early 1970s, a testament to our commitment to eliminating this disease even back then. Our first ever TB plan was launched in 2001. However, this remained a work in progress as the world of medicine and medical research continued to develop. The TB plan gave way to the National Strategic Plan to control tuberculosis, and then that one flourished into the new National Strategic Plan to end TB in Maldives by 2025. These policies and plans of actions have ensured that our commitment to provide universal access to TB care and prevention services did not waver, even during the pandemic, when our resources were at their lowest and accessibility was difficult. The pandemic may have delayed us on some fronts, but it did not prevent us from implementing our TB services, and we did it with no discrimination to race, religion, nationality, or socioeconomic profile. The non-discriminatory policy has been in place from the very onset. Through COVID, Maldives increased its diagnostic capacities remarkably. We now have gene expert facilities available throughout the country, a true example of providing integrated and patient-centered care for TB patients. In the 80s, Maldives reached 98% of BCG childhood vaccinations. DOTS program was introduced around the same time, and cure rates reached 97%. As a result, Maldives was celebrated as one of the only 5 countries to have achieved the global targets in case detection and cure in the 44th World Health Assembly. Our commitment has remained constant as we continue to invest in TB elimination to ensure that all patients diagnosed with TB are closely monitored and provided access to the latest tools and treatments free of cost. We proactively drive the cross-sectoral collaboration and program alignment, bringing together different sectors and service providers for better coordination to implement prevention programs and strengthen our advocacy and awareness efforts across the country and institutional borders. Currently, TB education and screening is provided in closed settings, such as at penitentiaries, facilities for substance users, and workplaces, all free of cost. Consequently, these cross-sectoral policies and innovative plans and actions have enabled Maldives to remain a TB-educated and low-prevalence country for all forms of TB. So what is the future of our TB program? Ambitious, but as you have heard, we are pretty good at achieving our goals if we put our collective minds to it. Our goal is to end TB by 2025, way ahead of the 2030 global target. We will start by establishing 100 TB-free islands across 13 atolls by 2024. It's actually 106, but I've been told 100 sounds better. For proper context, we have 20 atolls and 200 administrative islands. So we are talking about covering half of the Maldives. We will achieve this by integrating TB prevention, screening, diagnosis, and treatment into our primary healthcare model demonstrated at FAF, the rural primary healthcare model, and Hurmal, the urban primary healthcare model. The development of a digitally powered tool in DHIS2 is underway. This will allow us to track the program implementation, measure its impact digitally, troubleshoot where necessary, and modify the course of action accordingly. The module will also enable us to monitor the at-risk populations and people on treatment. As I mentioned, ambitious but doable because we won't be working alone. I would like to conclude by reaffirming Maldives' commitment to the Gandhinagar Declaration and calling for a strong regional one voice at the United Nations high-level meeting on ending TB by 2030. There is nothing our region cannot achieve if we bring our brains and brawn to work together and work as a team. Let us share our lessons, both successes and failures, both within our region and across regional borders. The lessons from India, the community support groups, the monthly food baskets to ensure proper nutrition for TB patients, the screening and testing strategies are truly eye-opening. Let us share our technologies and resources both within and across the regions, because a success for one is a success shared. Furthermore, Maldives calls for intensified attention towards low-burden, small-state countries with challenging geographies. Because even though the numbers are small, the complexities remain the same. As Dr. Tedros mentioned, we need all hands on deck to end TB. So let us achieve this goal once and for all, together as one. Thank you.
Thank you very much indeed for your ministerial address in support of the joint declaration. Thank you very much, Honorable Deputy Minister of Health from Maldives. I now have the privilege in inviting His Excellency, Mr. Mohan Bahadur Basnet, Honorable Minister of Health and Population from Nepal, to give his ministerial address in support of the joint declaration, please.
Honorable Health Minister of India and other honorable ministers from Southeast Asia region, WHO Director General Dr. Tedros, respected regional directors, WHO CEROs, esteemed leaders from the global TB community, and friends, reporters. I would like to commend the WHO Regional Office for Southeast Asia for convening this important meeting. It is my honor to address this gathering on behalf of the government of Nepal and to renew our commitment to ending TB by 2030. Your Excellencies, as we unite to embrace the Gandhinagar Declaration, I must commend the solidarity demonstrated by all member states towards fighting TB, which continues to remain one of the major health challenges of our region. Nepal has an estimated 69,000 TB incidents every year, and over 37,000 TB cases were notified and enrolled into treatment in 2022. Despite the challenges, we stand resolute in reducing TB incidents and putting an end to the TB epidemic in Nepal. As underscored by our national strategic plan, we hold a visionary aspiration of TB-free Nepal by 2050. Nepal is making strides towards self-reliance and program sustainability through increased domestic funding, localized TB responses, as well as multi-sectoral and community-driven actions at the local levels. In November 2021, we launched the TB-Free Nepal initiative in 25 municipalities, with plan to extend it nationwide, covering all 753 local levels within the next 5 years. This initiative assures resources generation, tailored planning, and accountability at local levels, supported by federal and provincial governments. We stand committed to ensuring sufficient resources towards strengthening our TB infrastructures and services for realizing the vision of universal health coverage. This rests on the foundation of comprehensive multi-sectoral coordination and community engagement. In this critical endeavor, I appeal the esteemed global TB community leaders and all key stakeholders to amplify collaboration with Nepal. The support and partnership of global leaders and communities are not just valuable, but truly indispensable as we embark on a path to TB-free Nepal. I thank WHO for its ongoing advocacy and effort in arranging this regional meeting. The Gandhinagar Declaration will undoubtedly provide impetus to the member states, including Nepal, to combat TB and accelerate our momentum to attain the target to ending TB in the region. Nepal stands together with unwavering determination and shared commitment in this transformative journey. Thank you. Namaste. Vasudeva Kutumbakam.
Thank you very much indeed, Your Excellency, from Nepal, for your ministerial address on the joint declaration. Thank you very much for a most wonderful address. Well, ladies and gentlemen, now is a very momentous occasion that we've been all waiting for. And for that, I have the privilege in inviting the honorable ministers who are seated on the dais and Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia, to kindly sign the joint declaration on my extreme left, which is there. There's an easel there. So if you can sign it, please. And let's give them a huge round of an energetic round of applause when they do that. So this is the signing of the Gandhinagar Declaration, ladies and gentlemen. Kindly move to the easel, please. Honorable ministers, kindly move to the easel for signing the joint declaration. Please keep the applause going, ladies and gentlemen. This is the Gandhinagar Declaration, which is being signed by our honorable ministers from Bangladesh, Bhutan, Maldives, Nepal, and Sri Lanka. And Dr. Poonam Khetrapal Singh is all here on stage, so you can take lovely camera shots. And whilst you're signing, honorable ministers, do pose for our members of the press and media who are waiting earnestly for your photographs as well. May I request honorable ministers and everyone on the stage to kindly be there for a wonderful group photograph, please. Thank you. If you can just form a nice semicircle so that a photograph would be wonderful in front of the easel. And a nice smile for the photographers, please. Thank you very much indeed. Let's give a warm round of applause, ladies and gentlemen. The Gandhinagar Declaration has just been signed. And now, ladies and gentlemen, I have the privilege in requesting Dr. Odetta da Silva Vegas, Director General of Health Services, representing the Ministry of Health, Timor-Leste, to kindly address us, please.
Thank you for the opportunity. His Excellency, Dr. Poonam Khetrapal Singh, Regional Director. His Excellency, Dr. Hans Henrik, Regional Director, Europe. Excellencies, Ministers of Health and Head of Delegation from SEAR member states, distinguished ladies and gentlemen. Very good evening to all. Timor-Leste delegation, on behalf of the government and its people, presents their compliments and thank Regional Director Dr. Poonam Khetrapal Singh for convening this important meeting. We commend and applaud the visionary leadership of Regional Director Dr. Poonam, the regional flagship, including on combating TB, and appreciably note ending TB as the WHO global flagship by DG Dr. Tedros. Let me begin by profoundly thanking Dr. Poonam for your constant encouragement and fully supporting us with your regional and country teams, not only to sustain, but to accelerate efforts for ending TB, even during COVID-19. Timor-Leste has the 7th highest TB incidence globally, 2nd highest in the Southeast Asia region, and 3rd highest TB mortality rate. It's the motivational support of regional director that resulted in my government recommitting with a pledge in 2024 itself to accelerate efforts to end in TB by 2025 in our endeavor to achieve the Sustainable Development Goal, particularly Target 3.3. Recognizing that business as usual will not result in achieving the goal, the National Plan for Accelerated Action for Ending TB 2021-2025 was developed with WHO technical support. The plan includes multi-sectoral actions and innovations using cutting-edge technologies for expediting case detection, laboratory confirmation, improved treatment adherence, and addressing the dropouts. I'm delighted to share that significant progress is made on all these fronts with one-stop mobile TV diagnostic van, household screening by portable digital X-ray with artificial intelligence, mobile application for TB, vulnerability assessment, and incremental support to augment the laboratory capacity for universal molecular diagnosis. And we are moving towards an integrated case-based electronic surveillance system for TB, HIV, and malaria, with the intent to capitalize on high-impact innovations. TB is linked with poverty, malnutrition, poor housing, indoor air pollution, and tobacco consumption. Almost all these factors are highly prevalent in Timor-Leste. These reflect on the necessity of multi-sectorial actions, and these determinants need more comprehensive response from government, development partners, civil society organization, and international community. Though high return on investment in TB, such as $43 to $1 is known, yet it has not been easy to secure sustained financing. I'm grateful to partners in Timor-Leste, especially Global Fund, OICA, and WHO for their constant support. However, I wish to highlight the critical importance of adequate, sustainable, and predictable financing, including domestic resources. Excellencies, DG and Madam RD, the UN High-Level Meeting on Combating Tuberculosis offer a unique opportunity to further accelerate the momentum to end TB for WHO regional and global flagships. From Timor-Leste, I'm honored to express the commitment from the high level, including assure participation in the UN high-level meeting. My delegation fully support the ideas of establishing the multi-sectorial commission to monitor the progress of ending TB, to advocate for higher allocation of resources and calling on their partners, including civil society organizations, for enhanced support and continued engagement for collective efforts to end TB. The visionary leadership of Dr. Tedros, DG, and Dr. Poonam RD, SEAR, is most sincerely appreciated as we took to WHO leadership and continuing technical support in implementing science-based solutions for equitable TB service coverage. My delegation and I thank Dr. RD Poonam Singh for her inspiring leadership, and as an is insight, we look for concerted, cohesive, and collaborative actions to end TB in Timor-Leste across the Southeast Asia region and globally for a fair and healthier future for all. I thank you. Obrigado, Bharat.
Thank you so much, Dr. Odeta da Silva Vegas, Director General of Health Services, representing the Ministry of Health from Timor-Leste. Thank you very much indeed for your address. I now have the privilege in requesting Ms. Françoise Avani, Director of External Relations and Communications, Global Fund, to talk about the support for ending TB in the Southeast Asia region. Over to you.
Honorable Ministers, Director General, Regional Directors, distinguished delegates, dear colleagues. The Global Fund partnership was created 20 years ago to accelerate the fight against TB, as well as HIV and malaria. And since then, as we know, remarkable progress has been achieved and millions of lives have been saved. But TB, a preventable and curable disease, still kills one person every 20 seconds. With the high-level meeting on TB coming up next month, we have an opportunity to further accelerate the fight and get back on track on the trajectory needed to end it for good by 2030. The Global Fund, as you know, is by far the largest international funder of TB responses, providing 76% of all international funding for TB. Following our seventh replenishment last year, the Global Fund allocations to countries have increased by 3.3% for the 2023-2025 cycle, and the amount allocated for TB has increased by $154 million. The Southeast Asia region accounts for 45% of the global TB incidence and more than half of global TB deaths, as we know. Progress made in this region, therefore, drives global progress, including our collective goal to end TB by 2030. The Global Fund total investment in this region during the current cycle was $1.3 billion and has increased to $1.4 billion for the 2023-2025 cycle. For TB specifically, the allocation to the Southeast Asia region increased from $734 million to $748 million. Given the burden of TB in the region, it is not surprising that some of the largest recipients of our funding for TB programs are in the region: Bangladesh, India, Indonesia, and Myanmar. In addition, national TB programs also benefited from funding from the Global Fund's COVID-19 response mechanism. Over $300 million have been awarded to mitigate the impact of COVID-19 on TB programs globally. These investments are contributing to the recovery of TB programs from the devastating impact of COVID-19. Data from 2022, soon to be released, indicates that TB programs achieved a sharp acceleration and remarkable recovery following severe disruptions in 2020 and 2021. In the countries where the Global Fund invests, we registered an increase in people diagnosed with TB and in people treated for TB, not only erasing the losses of 2020, but exceeding the pre-COVID results in 2019, which is really remarkable. Innovations, such as integrating screening for TB alongside other diseases and new treatments, including for drug-resistant TB, are boosting our collective progress. But this is not enough, and funding for TB is far short of what is needed. Of concern is the declining trend in funding for TB since the peak in 2019, both globally and in the Southeast Asia region. Since most of the funding for TB comes from domestic resources, 62% in 2021 in the Southeast Asia region, it is imperative that we continue to mobilize political commitment in each country to adequately fund TB programs. We have seen the great leadership and commitment from some heads of state in this region, including our host country, India. We hope to see many more countries accelerating their national TB response by committing more domestic resources. On our part, the Global Fund is also working across partnerships to leverage blended finance and debt swaps that translate unprecedented levels of debt and borrowing into tangible health outcomes. The Global Fund has supported blended finance transactions supporting TB programs in Indonesia and India recently. But TB requires more than money. It requires going beyond biomedical approach to address key social and economic determinants of TB, such as poverty, malnutrition, inequity, stigma, and more. It is therefore imperative that the response involves multi-sectoral frameworks and platforms for sustained political commitment in each country. Excellencies, the three UN high-level meetings on health this year provide a unique opportunity to boost the momentum to end TB and to foster greater integration of efforts to end TB, to make progress towards UHC, and to enhance pandemic prevention preparedness and response. To end TB, to advance UHC, and to prevent and prepare for future pandemics, we must focus on tackling inequities and meeting the health needs of the most marginalized and vulnerable populations. We very much hope that the ministers present today and their heads of state will participate in the UN high-level meeting on TB and commit to accelerate the fight. The Global Fund supports the draft UNHLM TB declaration with ambitious targets to end TB. Specifically, the Global Fund commits to promote equitable access to quality TB services through adoption and scale-up of TB innovations, to support increased and sustainable financing to close funding gaps for TB, and to contribute to find, diagnose early, and treat 40 million people with TB between 2023 and 2027. Excellencies, investing in TB is a smart choice. It will unlock the triple benefits of saving millions more lives while simultaneously building more resilient, equitable, and sustainable health systems that can help us achieve UHC and make the world battle ready for future health threats. Congratulations on the Gandhinagar Declaration. Together, we can end TB. Together, let's do it. Namaste.
Thank you very much, ma'am, for your most wonderful address on support for ending TB in the Southeast Asia region from the Global Health Fund perspective. Thank you very much. I now have the privilege in requesting Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia, to kindly give her closing remarks, please.
Honorable Ministers of Health from the Southeast Asia region, Regional Director, WHO Europe, Dr. Hans Kluge, distinguished partners, and our friends from civil society. We have come to the close of this high-level meeting, a historic moment in our onward journey to end TB in the Southeast Asia region. A journey that was launched in 2017, renewed in 2021, and today we have accelerated that momentum. Ending TB was never going to be easy. We knew that right from the beginning. And our task has been made even more challenging by the COVID-19 crisis, which disrupted health systems and exacerbated key social determinants of TB, such as poverty and undernutrition. But we continue to remain committed. Today we heard from the Honorable Health Minister of India what innovative steps India has taken, which have been initiated right at the level of the Prime Minister of India. We heard about the direct benefit transfer scheme. We heard of Nikshay Poshan Yojana. We heard of Nikshay Mitras. We heard of the strengthening of diagnostics, the improvement of the private sector. We also heard from the regional director of the European region, Dr. Hans Kluge, how the WHO Europe region is mobilizing commitment and ensuring heads of states commitment for next month's UN high-level meeting. We heard today from Dr. Tedros why access to new and improved TB technology tools is extremely important to avert death and suffering and promote people-centered care. The Honorable Minister of Bangladesh shared his successful experience of expanding access, which was very inspiring. We heard from the Minister of Bhutan how community participation is extremely important. And Maldives, the Minister of State, highlighted the need for multi-sectoral approaches. Nepal shared how the country has been able to make significant inroads to end TB, to achieve TB milestones through effective micro-planning, and they have gone right down to the subnational level. I also thank Francois Wani, Director, External Relations and Communications, the Global Fund, for highlighting how Global Fund is supporting our efforts. And finally, I thank all our partners and friends who continue to stand with our region and our onward fight against this ancient disease. Your solidarity is greatly appreciated. We thank Timor-Leste for their support always for the region and what the region is doing. It is a region which has challenges of immeasurable amount, and yet they have been able to successfully deal with them. Excellencies, the Gandhinagar Declaration is a landmark statement. Not only does it acknowledge the transformative changes in our region, catalyzed by the declaration of ending TB as our 8th flagship priority, but it also charts the path forward, reiterating the region-wide commitment for priority TB interventions. Crucially, it reinforces our collective approach to leveraging the upcoming UN HLM and will also complement a proposed integrated approach for elimination of diseases, an innovative approach that can ensure sustained community engagement, efficient and effective use of limited resources, and maximize political capital. And that is what all of you emphasized. An approach that will help us to move towards SDG 3.3. At both the UNHLM and our planned side event on an integrated approach to eliminable diseases, we look forward through the highest level of participation. Together, from Gandhinagar to New York, let us move boldly and end TB once and for all. Thank you.
Thank you very much. That was Dr. Poonam Khetrapal Singh, Regional Director of WHO Southeast Asia, kindly giving her closing remarks. And with that, ladies and gentlemen, we come to the end of this wonderful event. We do hope you've enjoyed being with us here as much as we've been enjoying to be with you here. Thank you very much, and namaskar, and have a wonderful evening ahead.